Hey guys, today we're going to talk about the thymus gland in relationship to stress. Now, what is this thymus gland? Well, it's part of the immune system, and you have a lot of different immune glands. You have the spleen, you have certain immune cells in your bone marrow. There's part of the immune system in all your lymph nodes around the body, in your liver. So the thymus, being an immune gland, has these cells called thymocytes, which make T cells. And T cells are white blood cells, and they help protect you against certain foreign invaders. And the thymus gland is like a training camp for T cells. So what's happening is, especially early on, when the thymus is very, very large, when you're a baby, your thymus is very, very large. Okay, as you get older, it shrinks to the point where you get really old and it's barely there. But when you're a baby, as your body becomes exposed to the environment, it's constantly adapting itself to protect against foreign invaders. So if there's any weakness within the thymus gland, you're going to be predisposed to getting viruses and bacterial infections because you can't fight them off as well. Also, it increases your risk for cancer because the immune system is very, very important in not just fighting off cancer, but disease in general. So the thymus gland is also involved in getting rid of the T cells that are attacking itself in autoimmune conditions. So they're constantly trying to get rid of this self-attack. Now, when you have an allergy, you have a hypersensitive immune system. When you have an autoimmune disease, you have a hypersensitive immune response. And on the flip side, there are other conditions which are hyposensitive or immune deficient, which is just the opposite. It's not a hyper reaction, it's a hypo, like the immune system is just not able to respond, like in HIV, for example. But the biggest tip that I can give you related to the thymus gland is this. Cortisol, which is a stress hormone, lowers the thymus. Okay, so I'm going to show you in this book right here, Frank Netter's Encyclopedia of Endocrinology, on page 84. It talks about the biological actions of cortisol. Cortisol suppresses the thymus gland. And this is why, for example, in allergies or autoimmune, they give a person prednisone or a type of cortisone shot because it'll get rid of that inflammatory response because of the fact that cortisol decreases this hypersensitivity. So there always seems to be, right after a stress event, a susceptibility to pulling in this infection. So if you have a room of people that are exposed to a certain virus, some people will get the infection and other people won't. And I really believe it has to do with cortisol and stress. Those people that have lost their tolerance to stress or are more overly stressed tend to pull in that virus way more than those people who are not affected by stress. In fact, over the last 29 years of practice, the people that I talk to, not just getting sick, but developing autoimmune conditions, when you interview them, it always happens after some stress event, whether it's a loss of a loved one or a traumatic experience, and boom, they start developing this immune condition, which is interesting. So the reason I'm telling you this is that if you have chronic infections, for example, if you have some type of autoimmune condition, this is where you need to focus right here, eliminating this stress as much as possible. Yes, you need to increase your vitamin C and your zinc and your foods, but don't forget about addressing this very important factor of stress. Because I believe unless this is dealt with, no amount of nutrition is going to really make an impact. All right, thanks for watching. So I want to thank you for being here and watching my videos. If you haven't already subscribed, go ahead and do so you can stay informed of future videos.